Good morning, and thank you so much for tuning in. I'm Brittany Stiles from Midwest Family, and I'm live from Gunderson Health System. We are here today and tomorrow, 6 a.m. until 6 p.m., both days, for the Children's Miracle Network Hospital's Radiothon. And really, it's all about making sure that you understand the amazing things that the Children's Miracle Network Hospitals organization does right here in our community. So that's another thing for you to know, that when you make a donation, that money stays local to help all of the kids that are right here in our area suffering from illnesses and just a variety of different things. So you can make those donations a couple of different ways. You can call 1-800-853-6889. Again, 1-800-853-6889. You can also text CMN Kids to 51555. Again, text CMN Kids to 51555. You can watch our live stream at aroundrivercity.com and also make a donation that way. And I would encourage you to tune into the live stream, because you will be able to see precious babies like the ones that are right in front of me right now, Samuel and Timothy McKenzie, who are 8 months old today. Hi. Oh my goodness, so cute. Okay, and I'm also here with Mom and Dad, John and Rebecca. So, John, can you tell our listeners what actually happened with your family that prompted you to need the help of the Children's Miracle Network Hospitals organization?
Yeah, thank you. Yeah, so being a parent is full of unexpected things, and I don't think anyone ever expects to need help or to end up in the NICU, but it happens. Even from the start of the pregnancy, we thought we were having one child, and during the ultrasound, the tech, we'll never forget, the ultrasound tech says, "Wait a minute, there's two of them in there."
Oh,
I'm like, "What? Like, you've got to be kidding me." But sure enough, there's two little sweet boys. And the next unexpected thing that we got was 3 days before they were born, Rebecca's water broke, and we found ourselves
2 months before.
What?
At 31 weeks.
At 31 weeks.
3 days before they were born, though, but yeah. Yeah, sorry.
Okay.
Thank you. Yeah, so at 31 weeks, I got a call. I had like 6 missed calls from Rebecca when I was at work, and the text word, emergency. And I'm like, this is not good.
No.
So I call and find out that her water had broke, and I'm like, well, this is way too soon
Too
than
early.
what it's supposed to be. So we head to the hospital, and they had us stay in hospital. She had to be on bed rest. At that point, when you're early, I learned that they try to keep the babies like cooking inside,
Sure.
long as they can. But in the end, the babies had to come out. So they were born on Valentine's Day, one day before our first wedding anniversary.
Nice.
Which is great. But they were born at just over 3 pounds apiece, and so they needed a little bit of help. Excuse me. And it was just a really stressful time, because we didn't know. Everything was just unexpected with the delivery, and it was challenging in many ways. And then also not being able to be with the babies right away, because they had to be whisked away, and little help with breathing, little help with like jaundice, and just some of the other things that go along with being a preemie. So we found ourselves in this whole world unexpectedly overnight, literally, and didn't realize that we were going to spend the next 79 days
79 days
in the NICU, and not knowing when we were going to be able to go home.
Right.
So that's where CMN really helped us. We have they have 2 older brothers and an older sister, and we had to spend our time, juggling work, those kids at home,
Right.
these kids here in the hospital. And to be honest with you, the last thing on our minds so often was taking care of ourselves.
Yeah,
we were just up
sure.
all hours of the night, and you can get burned out a little bit that way.
Mm-hmm.
But luckily, CMN was there to help with the meals specifically. They offered meals to the parents who are in the NICU. So when you're sitting there and it's 5 o'clock in the afternoon and you realize that you haven't eaten all day,
Right.
the nurses will be like, "Hey, go take a break, go get some food. It's covered, and you can take a break, eat. You don't have to leave the hospital. You don't even have to leave the NICU. You can just go to the break room, and you can get some food, recharge, and then come back and be right back with the babies."
And I would imagine that is probably, all you care about at that moment is keeping these guys safe and healthy and just
Yeah.
praying that they're, but you're right. You do forget about yourself. I'm sure that's super easy to do.
But you realize that for you to be there to support them, it also means you have to take care of yourself.
Yes.
So we're so grateful, because if you can imagine trying to order food out or something for 79 days in a row.
Right.
It would
Expensive.
have got really
Yeah.
very, very, very expensive. So we're just really, really grateful for the help and for the care. And there always seemed to be a social worker popping by to see if we needed any help and mentioning all the ways that CMN can help. Luckily, we live just a few minutes away, so we didn't need like gas cards or mileage cards
Sure.
or those types of things. But
Yeah.
we're so glad that that is available for families, because again, nobody plans to end up in the NICU. Nobody plans to end up needing all this help, but it happens.
Well,
it can
and I was
happen to
just
so
told
many people.
also that one of those machines that was helping to keep your babies alive and safe is like $50,000, right?
Yes,
And
yeah.
so that's where you come in. If you're listening, your donations can certainly help with medical equipment and all of the things that you were mentioning. And that's what Today and Tomorrow really is all about here at the Radiothon, live from Gunderson Health System for the Children's Miracle Network hospitals. And you can make those donations a few different ways. You can call. The volunteers are waiting for your phone calls here. 1-800-853-6889. Again, 1-800-853-6889. You can also text CMN Kids to 51555. Again, CMN Kids to 51555, or at aroundrivercity.com. And you can also check in on the live stream as well. So I'm here with this family, Samuel and Timothy McKenzie, who are today 8 months old. And unfortunately, they spent a good majority of their first, month and a half or so? 2.5 months, in the NICU. And so how long was it before you actually got to physically hold them?
What was it?
Oh, get your phone.
It was like at the beginning, after a week, I
Yeah, a
think
week or so.
we were able to hold him, but it was just 1 hour a day, and
Yep.
it's skin to skin, and you cannot move,
Right.
basically, because you cannot move the baby. They're very fragile. And then it started to be more and more, but at the beginning it's just 1 hour a day, and it was the most precious hour of our day.
I'm
And
sure.
we waited for that moment, and then it's very hard to be with your babies at the NICU. It's
Right.
very hard experience, and everyone was very loving, and they help you to go through the whole experience
Well,
the best
and
they can, but
I
it's
would
very
think,
hard.
the Children's Miracle Network hospitals organization, the employees and everybody, they were probably kind of like your family at that point, because I know COVID is still going on. And at that point, they probably didn't allow a lot of extra people in there, right?
That was
Oh boy.
yeah, that was another real challenge for us.
Sure.
So Rebecca's from Costa Rica, and so our family, a lot of it on her side, is from Costa Rica. We had mother-in-law here with us and my daughter with us at home, but they weren't able to visit at all, and
Sure.
neither was my dad. So you think about all the support system that you would typically have in a non-COVID time, able to come and at least visit the babies or be with you, and it wasn't that with
Yeah.
COVID, understandably.
Right.
So it really just put, everything, all the care, everything on Rebecca and myself.
Right. Well, I'm so glad that the Children's Miracle Network Hospitals organization was here for you in a few different ways, and, helped you through that difficult and unimaginable process that you went through. And I see that they're both doing very well, and I assume they're healthy and thriving. And
Yeah, we can basically say that we were living at the NICU for 79 days.
Yeah,
'cause
right.
We would sleep there most of the time.
Sure.
As much
Because
as
I
we
didn't
could.
want to leave the babies for
Yeah, of course.
not even for a moment.
No.
And the nurses go take care of it.
Right.
But you just don't want to.
Yeah.
They're well taken care of, but they're
Yeah.
your babies.
Oh.
But yeah, they are very loving, and you can see how much they care for the babies. That
Excellent.
they're very well taken care of.
And that is what your donation is going towards today and tomorrow right here. We are live from Gunderson Health System for the Children's Miracle Network Hospital's Radiothon. And all of the things that you guys just talked about, you know, all of those funds help all of these different programs to make families and children, you know, safe and healthy and happy and just get you through the really tough times. And if you are able and willing to donate, any amount would be grateful, and we would appreciate it so much. You can do this a couple of different ways. Our phone operators are standing by. You can call 1-800-853-6889. Again, 1-800-853-6889. You can also text CMN Kids to 51555. CMN Kids to 51555 or at aroundrivercity.com. And again, special thanks to our sponsors, Stanek Electric, Mark Jewelers, Cooler Region Mobility, Team Marine Services, Ultra Federal Credit Union, Oral Surgery of La Crosse, Gunderson Health System, all of the volunteers for helping to make this possible. Now, the rest of today until 6 o'clock and tomorrow 6 until 6 again, you will hear more stories just like the McKenzie family and other Gunderson doctors and professionals who helped to make all of this possible. We are live from Gunderson Health System for the Children's Miracle Network Hospital's Radiothon. I'm Brittany Stiles for Midwest Family Lacrosse.